NSIC, Nigerian Society Protection Control. Today, we have a good topic ahead of us to be discussed. We also have a speaker, even though I'm not sure he has joined yet, but I will go ahead to make the necessary introductions while healing. And it's my pleasure to welcome everyone to today's section. And our topic today says IPC Professionals, the Frontline Against AMR, Empowering Action Through Knowledge. And today, as we got as healthcare professionals, advocates, and as well as stakeholders, united to addressing this critical public health challenge of our time, this topic is actually very, very, very timely. And as we all are aware, AMR threatens the very foundation of modern medicine. It endangers our ability to treat infections, perform routine surgeries, and also manage chronic illnesses effectively. So yet, as daunting as this challenge is, it also presents us with an opportunity to act decisively as well as collaboratively. And this section is going to be centered on the vital role that we professionals play as frontline workers to fight against antimicrobial resistance. And our collective knowledge, expertise, and commitment are most important tools in addressing this threat. So today, as we engage on the discussions and deepen our understanding about AMR, and also equip ourselves with insightful knowledge to strengthen our efforts, I want to welcome each and every one of us, and thank you very much for being part of this conversation. And I look forward to a full discussion ahead. And also, please, while the section is going on, if you have any questions, please, we really, really appreciate that we have those questions, and they will come towards the ending of the section. I will go ahead to introduce our speaker. And let me check if he has joined. Dr. Nemeka, please confirm that you're on the call. Oh, yes. Dr. Nemeka. Oh, good to see that you're here.
Yeah, good
Welcome.
afternoon. Yeah, thank you.
Good afternoon. Good afternoon. Good afternoon. We're very happy to have you in today's section. I'll go ahead to introduce him to every one of us. So Dr. Nemeka Sebudu is a public health physician. He's a chief resident of the Department of Community Medicine, Nnamdi Azikiwe University Teaching Hospital. He's part of the IPC team of the NAUTH. He was a member of the scientific expert panel of Shelina Healthcare, and also was part of the technical working group for drafting their AMR national protocol. He has trained doctors, pharma committee members of antimicrobial stewardship programs in many facilities, tertiary hospitals on AMR. He's also actively engaged in advocacy to combat AMR in all settings. So we're really, really happy to be here. Welcome once again, Dr. Nemeka, and you have the floor now. Thank you so much. Would you want to, I guess you want to share your screen. Please go ahead, you have the floor. Thank you.
Okay, good afternoon, everyone. Just a second. Okay, is my screen visible?
Yes.
Yes, sir.
Okay, just a minute. I need to minimize a lot of things here. Okay, good afternoon, everyone. Please, let's confirm that I can be heard.
Yes, we can hear you, sir.
Yes, we can hear you.
Go ahead.
Okay. Yeah, apologies for coming in a bit late. I had a lot of technical issues coming in. But that being said, it's a pleasure to be in the midst of healthcare workers, senior colleagues, and colleagues. I understand that it's more inclined to IPC, the diploma program that CCAPS is involved in. So I want to just start a discussion. I'm not going to be able to pull through everything that is expected But what I will do today is steer everyone's heart to the direction the world is headed to, and I would actually welcome engagement at the end that will bring out more information. So today we'll be looking at AMR, so to say. So we're trying to find out the role I have to play. So IPC Professionals, the frontline against AMR, antimicrobial resistance. So we're empowering action through knowledge. Very apt, I would say. So that's my outline. I'll definitely move more than this, but this is what I intend to run through. Then we'll discuss at the end. So let me give you a background. Now, we're talking about AMR, full definition of full meaning, antimicrobial resistance. Now, when you get to antimicrobial resistance, we're talking about antibacterial drugs, antiviral drugs, antiparasitic drugs. So basically everything that we basically use in combating infection. So I've written antibiotics here because most times that's what most people mistake it for, but that's not exactly what it is. So antimicrobials happen to be the best discovery of the 20th century. If you go, I'm an epidemiologist in training. If you go back and look at the world population and check the timeline, look at the way the population has actually increased and reduced over time, you would find out that when we had serious dip in the world population, it was because of great plagues. You know, there are many of them that have happened, the Black Plague, all of them, bubonic plague, and even the COVID-19. If you look at the world population after the pandemic post-2021, you notice that there was a great dip in the population of the world. So the antibiotics actually helped mankind to combat loss of lives due to infections from antibacteria, from bacteria, as well as from what they call fungi, as much as we talk of antivirals. So the question is, why are we playing with what we consider to be our best invention? That's what the focus of this discussion is. So man's activity has actually affected and has actually given rise to antimicrobial resistance. We get to understand what it means. When we're talking about misuse, a lot of people go over the counter. Every febrile infection is considered to be a parasitic infection, and lo and behold, you pick up an anti-malaria. And to add it, those over-the-counter patent dealers would normally add called an antibiotics that most likely they do not complete the full dose. So you're doing all these things without knowing what you're treating. So the use and misuse. Now, I just talked about getting a prescription over the counter, and because you only cross over there, all they care is the funds you're going to give them. So you say, I don't have 50, I don't have 5,000, and the drug, the appropriate dose should be 5,000. So what they do is just cut the dosage and give. So we'll have on the dose, then overuse. Everything in our balance is enteric fever and malaria. These things have actually prompted the increase in the development of antimicrobial resistance. Now we now have superbugs. So antibiotics and antimicrobials are no longer being manufactured. They can ask those in the pharmaceutical firms. Newer versions are now coming out. So just like we have a classification we call the AWARE classification, the restricted group, we've gotten to the head bridge. We can't do a lot more. So what we are doing now is shooting ourselves in the foot, because if we misuse the ones we have around, we will have organisms come up that are way stronger than the ones we have in our vicinity. So the question, the focus is infection prevention and control measures. That's key in combating the rise of AMR. This is what we'll find out as we go down. So let's look at the magnitude. How severe is AMR? I know most of you haven't heard. If you go to the WHO website, you find these details there. The issue here is a problem of information. If you tap your colleague at work, nurse, doctor, pharmacist, and you ask them, have you heard about AMR? the first thing they will ask you is, maybe I've heard. The first they will say is, maybe I've heard. Then go a little further and ask, do you feel it impacts your life and my life? And the question will be, how do I know that? So that's the issue. But the truth in balances and in crimes where we study, we found that the WHO has found that an estimated 10 million people will die of diseases related to antimicrobial resistance. And point is what we hope to change by having this discussion today. Africa is most hit. 40% of these deaths will come here. We don't do a lot of due diligence with research, we just consume. AMR superbugs are already responsible for 1.2 million deaths. So people say, how can you prove that? You're not looking for it, but it's out there. So this data is factual as WHO. So I just want to read a report, permits me. Now, the former director of WHO, that's Margaret Chan, said antibiotic resistance will lead to the end of the modern medicine as we know it. I just made something clear. If you do not have any other organism, if you do not have any other arsenal in your with you to combat superbugs that are coming up, we revert to the issue to the previous seasons of plagues when whatever infection comes out wipes out almost half of the population. Just look at the picture. That's a microorganism giving out a knockout blow to the best thing we have on our hands. So the question is, how does this actually happen? Towards in the next few slides, I'll be able to explain them, but let me just finish. There are organisms popping up everywhere in all settings. You have MRSAs, that's antibiotics, we know, cephalosporins, third generation, fluoroquinolones, the Cipros, theofloxacins, all the ones you have 50% resistant, meaning that if I were to use this to routinely treat my patient empirically, when I mean empirically, what I mean is I've not sent the sample to the lab. What it means is that I am likely to have a 50% failure rate. That is alarming for a physician or for a healthcare worker. And that's because we have not worked or looked at the issue of antimicrobial resistance, 50% resistance to third generation cephalosporins to Klebsiella. These are very, very